it's not just time now to move to a conversation with our four panelists, and they all represent important projects with a very important participation of member states in it. So my pleasure to welcome Sieg Marbus from representing United for Surveillance Joint Action, Beatrice Barros, which represents today TEDAS2 Joint Action, Luis Alves de Souza, who is representing ECDC, and Christos Skizas, which is active both in ECAN and ECAN Plus, but also plays an active role in IXT-EHR. So I would like immediately to give the floor to, first of all, to have a quick reaction and asking Sieg Marbus, maybe, as you've seen, we have put a lot of emphasis on infectious disease surveillance. And I would like for you to tell us, are what we are discussing today part of your discussion in the joint action? Do you see this as a very important action point for you?
Thanks, Luc. Yeah, first of all, I think there are definitely the same topics discussed in United for Surveillance, the joint action that's started in 2023 and then will end at 2025. So there are big overlaps, and the same discussions that we're having here is actually the discussions that we had in United for Surveillance. So that's something, first reaction, and I must also applaud you for all the work that you've done, and also with regard to the interoperability part, because that's still a big issue with all the member states that are involved in United for Surveillance. There are over 40 partners, 24 member states involved in United for Surveillance, and the big diversity between these countries and the different systems they're using is one of the main gaps and challenges that we've encountered and identified. And as you know, I'm not sure if all the audience know, Joint Action United for Surveillance is really meant for developing a roadmap how we can get to a more integrated infectious disease surveillance system at national level, but also on European level. So we're not quite there yet. So that's maybe also a comment to make, that we're a little bit far off from a yellow button, if you know what I mean. So that's important to acknowledge. And there will be follow-up projects such as the direct grants for member states, which will implement the recommendations coming out of United for Surveillance. And I think especially in these direct grants, the projects of XShare could really be useful, and maybe also have more option to be utilized, and also maybe validated a little bit more.
Thank you very much, Sieg. Maybe asking Luis Alves from ECDC is also, of course, his daily business is also looking at those use cases in particular. And maybe the same question. So do you see what we are trying to do, and the work that we are trying to disseminate around this core data set, harmonization, being really a useful resources for you?
Hi, good afternoon. And firstly, thank you very much for the invitation. Thank you for all the background work that you very well showcased in this webinar, and for preparing the webinar. I think this, so in the backdrop of EHDS, what you've presented is an enormous effort, and I think it's a very substantial step forward into harmonizing sort of the digital health data ecosystem that we currently have at the EU level. And so this effort to harmonize aspects of syntax and semantics are definitely more than welcome. Some of the elements that you showcased for the antimicrobial resistance use case are particularly relevant because within the list of communicable diseases that are under EU law, so EU statutory surveillance law, AMR is perhaps the most complex sort of case definition. And so if we get this process of harmonizing this data collection for this disease, we will most likely get it right for all the other diseases. So that's also a very important detail on this work, this process. Eugenia talked had on one slide one specific point on leveraging the EU electronic health record exchange format. And it's not just the fact of providing a very good reference on syntax, a good reference on the model, and then semantics, but then this sort of reference of sort of uniform reference will not just improve data quality, but also sort of the potential of process quality, in the sense that certain tools that we already know that exist but are very hard to implement sort of at scale because of this kaleidoscope ecosystem, with this reference will likely will be easier to implement and to sort of implement a process and at scale. Some examples would be, for instance, imagine having clinical decision support systems that help not just the process of collection for the actual healthcare worker, but then help the healthcare worker on the process of reporting a notifiable disease that is mandatory, right?
Mm-hmm.
But because the background data has that reference, deploying a CDS system will likely become easier, and it will become easier across countries, right? So that's one direct benefit on existing surveillance systems, for instance, that already have to sort of report this data from member states to the EU level. So that's perhaps a secondary positive externality of this sort of work that is happening, right? But I will stop now. I have more points that I could refer, but I'll hand over my point now. Thanks. Over.
Thank you very much, Luis. And that maybe Christos, I come to you, Beatrice, right after you, the only lady. Sorry, you're the last one. But Christophe, you're involved in two major initiatives and three if we can. But looking more specifically on cancer, we know that cancer is important because a lot of resources are now dedicated to cancer research in Europe, and patient are impatient to see progress and so on. So the use case that we provide actually try to have more data quicker, maybe not the whole bench of data which are collected, but the ones which are really critical, and also make sure that the patient can make the best of those data for different purposes, maybe to identify ongoing research, maybe to be selected for studies, for whatsoever. So what do you think about the use cases that we have been developing, we have been documenting in each year?
Okay, thank you, Luke, for this opportunity and for the organization of this webinar. Listening to the presenters, the earlier presenters, I think I will say a few things about ICANN, but I will also mention the emblematic XDHR joint action, which actually addresses the concerns by the presenters. Now, starting to say that ICANN and ICANN Plus started before the regulation, the European Health Data Space Regulation was in place. These joint actions, they can aim to bring together the citizen, the patient, the doctor, the care provider for as a use case, with the aim to address the primary use of health data, as we call it, but also the secondary use by building algorithms which will facilitate mainly primary use and also planning for the patient associations, the ministries, etc. That was the main purpose. After the introduction of the European Space Regulation, we rewrote the proposal and another joint action, if you like, with larger participation and bigger funding, the ECAN Plus, which make compliant all the procedures and use cases to obey the European Health Data Space Regulation, which, as we all know, is approved about a year ago. It was put in force about a year ago. And the joint action, the XDHR joint action, is actually the joint action which I am coordinating with the participation of all member states for developing the implementation guides of the European EHR extended format, which we're going to deliver next April, and hoping that it will become the implementation acts for adopted by all European member states for actually creating their ecosystems. This is just to start with, and we can come again in the second round. Thank you.
Thank you, Christos. Just one thing which I think is important is just here, clearly we're speaking about asset and core set harmonization and so on. I think everybody is aware that that's only part of the story. I try to stress that in the best practice use case documentation for the 3 countries is that a lot of efforts in improving usability is needed. And indeed, the development of human competencies is specific human competencies in order to formalize those processes and to semi-automatize that as much as possible is also really an important precondition for that. That's really one of the key lessons of the ones who have succeeded to connect primary and secondary use of data for a number of important use cases. The second thing we've learned is that the more use cases you have, the more impact and the more powerful the incentives are. If you just ask the people to do the job only for one purpose, the incentive is still very meager. But once basically you are feeding data for quite a number of processes which are really important and can have very important organization and also maybe on the regulatory or regulatory level implications, that makes things different. Beatrice, I come to you now. You're presenting TEDAS2, and TEDAS2 is the project which needs to do what the XDHR is doing for primary use. So basically trying to standardize as much as possible and provide the tools and framework to organize the use of secondary use of data. So my question to you is basically, do you see what kind of priority actions do you think member states should do, especially seen from the actors active in the secondary use to push this? What are the priority things that public health authorities should do today?
Thank you. First of all, thank you for inviting me. It was very interesting to hear about the work that you are doing. It's good to see a lot of opportunities, as you said, and important developments. It's true, in TEDAS, we are working, I feel, on a different world. We are in the metadata level. And I think your question is important, because what I kept thinking when listening to this work is that one key priority should be a better alignment and communication and opportunities like this webinar for us in the secondary use to communicate with the primary use and vice versa. Because every time we have an opportunity like this, we understand what each side of the users are working towards and developing. But usually these efforts are made in parallel and both are in development. So it should be at this stage that we are aligning our efforts and understand the capabilities from both the work being done in both sides. So I would highlight this as a key priority to create opportunities for us to understand what are the challenges that we can tackle right from the start and while this work is still being implemented, not only on the technical side, but on the legal, the organizational side. In our discussions, we highlight a lot of semantic interoperability challenges. And even these technical pieces of the puzzle need to be complemented by these organizational aspects for us to really be able to bridge this primary and secondary use, because the secondary use with the HDS is a very big and ambitious vision, because it's not just about the data entry. It has a very complex, rather complex mechanism with a lot of actors and different infrastructures that are being introduced. So I would highlight here this need for good and continuous communication to build this actually integrated ecosystem.
Yeah, maybe on 2 points, and then I ask the three of the speakers maybe to complement you on this. But we've seen that today some countries have completed almost full inventory of all the major official registers and have tried to document it with a number of metadata, be it more or less standardized or not, that's another question, but at least they have already an idea of the ending point, which is, but what is the degree of maturity in Europe of this work, this very simple work of at least knowing what this universe is about? And my second question is that if the public authorities have invested in due time in the tools and the infrastructure to support both primary users, primary data producers, and secondary data users, for example, in terms of terminology servers, in terms of controlled vocabularies, and so on and so forth. Where are we in this reflection? So maybe just what is your evaluation of the degree of maturity?
Tricky question. I would say moderate maturity. I think it's really dependent on the country we are talking about and the efforts on being implementing, at least in TEDx for the, sorry, I keep hearing a lot of background noise. I will continue either way. Depending, at least in the secondary use, we see a lot this fragmentation on the maturity models of each country, not only on the, as I said, on the technical part, but even on the organizational aspects. Some countries have implemented and have already in place a lot of mechanisms for secondary use, but there are countries that are still starting. So there are a lot of fragmentation and even on the efforts and the directed efforts that are being put into question. So I would say it really depends, but in the EU landscape, I would say there's still low maturity, especially in this alignment with the primary use and secondary use. Because one thing we observe commonly is that usually different teams and even different organizations are tackling the primary use and the secondary use, and they are often not talking or aligning their efforts. And this could be really something that would move this work forward in a more efficient way.
Thank you very much, Beatrice. Maybe our three other speakers on this point, what do you think should be better done at national level, but maybe also at European level? Because speaking of terminal servers, I mean, should we try at least to map those international resources and that member states only deal with their problems and their legacies, and rather than we all redo the same thing? It costs a lot of money. And we see some countries are very advanced and some countries are nowhere. So what is your opinion? Maybe one who wants to start of the three other speakers?
I can, if you like, say something about this. Look, we start from the first initiative, the My Health EU, which has the national contact points to transfer patient summary across. This is going to become compulsory by 2028. So all countries should solve this problem. It will be the last chance to be connected. But this is not enough. The My Health at EU is only for patient summary. To have complete medical impact you have to be able to transfer the electronic health record. And this is the job of the My Health at EU and Beyond implementation, which has an horizon beyond 2030, and it's going to become compatible. The regulation is not optional; it's compulsory. So all member states should comply with the regulation. Second, as far as secondary use is concerned, EU is funding several projects like TECTAS to expand, and also giving direct funding to member states to develop the HDAP, the Health Data Access Body, in each country. This is not, as I said, it's not optional. It has to be done, and a lot of support is given to member states to comply with this. Therefore, this is the plan. But unless we have full participation and full electronic health record, it's all going to be a dream. Therefore, we have to have close monitoring with a good maturity model to observe countries which are going fast and countries which are slow, and enable them to come to the same level. Otherwise, the citizen will not get the full benefit of this dream, having to travel between various countries, not the same privileges to be offered. That's at the European level, not to force, to stress that we must consider the beyond Europe level, the international level, which is something not to stress at this point. Thank you.
Thank you, Christos. Sierk, do you want to intervene?
Yeah, so I think a key priority action is the legal constraints that we've been talking about earlier, and that's one of the main barriers that's actually withholding efficient data exchange between partners, between primary and secondary use as well. So if we don't solve those problems fast, then we're still we have a big problem. And of course, I agree that this European health data space will be mandatory in 2027, but it's not 2027 yet, and we're dealing with the current issue where there's problems with different interpretation of the GDPR within a country. They have their own, on top of that, they have their own privacy legislation. So there's a lot of work to be done. And within United for Surveillance, we feel that this is really the key priority that must be dealt with, and not only from national level. So you have to talk to your Ministry of Health and the legal experts there, that there's a more uniform approach per country, and we need guidance by the EU, what's already going on with the implementing acts. So it has to work together. But that's something I think is the major priority, to talk about European health data space and easy exchange using a yellow button, that kind of thing. So that's my opinion. And lastly, I would like to echo what Beatrice has been saying, that there is indeed a large heterogeneity between countries, between the Nordics, between smaller countries, and you really have to take that into account. It can't all be done at the same pace. So you might have to think about different help you do with different countries, right? So a really tailored approach for each country to get up to speed and get to where you want at 2027, or maybe before that level.
Thank you, Sierk. And Luis, maybe something you would like to add on this?
Thanks. I did take note of the mentioning. I think it was the presentation referring to Belgium, on the fact that they had their national terminology server and services. A lot of European countries have established that already, and there's definitely a piece of proper control, version control, archiving, and then proper service of this type of semantic service at national level. I don't think that at EU level something of this specific nature has been established, at least for the potential applications for secondary use in this case. But interestingly enough, if you read the EHDS regulation, there's no actual formal stringent or sort of stricto sensu restriction or requirement on the actual semantic intent of the data sets that are eligible for sort of reuse and the secondary use. I think it's Article 51, right? It defines categories, but it doesn't specifically determine that you need to have a specific code or terminology or classification in this specific data set that comes from this category type. On the EHDS primary use, there you see clearly sort of a direction of harmonizing and standardizing in several aspects. And so, curiously enough, this terminology services will likely be used will be rightly so used for secondary use. And at EU level, perhaps one of the areas where this could be placed is exactly on this Health Data at EU infrastructure. There are several elements there, and one of those could be related to sort of having some form of EU level terminology service. There's another advantage, and one of the advantages I think you mentioned is exactly the fact that you just have to act on one point and not 27 potentially, right? I think the mention just now of legal constraints are also very important to make. I don't know if everyone here sort of had the chance to read the EHDS regulation, but if you do read it all, you'll find that there are specific elements that you have to consider when sort of you anticipate using it either under EHDS primary use or secondary use. For instance, the possibility to opt out. So data subjects opting out of either primary or secondary use, it's there. There are provisions and circumstances and requirements on how that data could still be used, but then the delimitations sort of right now clearly determine in what scenarios sort of you could potentially use EHDS, and in what scenarios perhaps you might have to use other member state or union law. The example I'm thinking is, for instance, exactly for statutory EU law for public health surveillance of communicable diseases, where you have the serious cross-border threat to health regulation, it's perhaps more advantageous, you see, to enhance existing surveillance systems with the sort of tools that EHDS primary use and its harmonization in syntax and semantics will provide. And so you enhance existing surveillance systems for those diseases, and you use that legal vehicle. But then for diseases that are not under this statutory law, for instance, an Ecovirus 11 outbreak in newborns multi-country, so you want to study this specific outbreak, then EHDS provides a framework for doing that sort of outbreak investigation and in public health action. So it's about choosing the right sort of legal framework and also technological framework, and so it will be we'll also have to walk and learn, so to speak. And over for me.
Thank you very much, Luis.